Welcome to the HealthInsight Nursing Home Resident Safety Collaborative Learning Session 1. In this module, we will be reviewing one way to incorporate a JUST culture into your community with a decision tree and intervention tool. So now that we know what a JUST culture is from the previous presentation, how do you implement a JUST culture in your facility? The concept of a fair and just culture requires a simple and precise algorithm that fosters an environment in which staff members accept responsibility for their own actions, but know the organization will treat them fairly and not blame them for something out of their control. We are presenting you with one of several algorithms or decision trees that we adapted to the nursing home environment. We hope that you find this tool useful. The tool is broken into two parts: the decision tree and the intervention tool that will guide you in taking action. This is a 6-page document that is available to download from our website. Very few employees actually intend to cause harm. We encourage you to look at the system in which the employee acted. Do not jump to disciplinary action. The intention of this decision tree is to guide supervisors away from assumptions that there was an intentional violation. If an employee did intend to cause harm, we recognize that appropriate actions must be taken. This tool is intended to engage employees who did not intend to cause harm. The guideline is broken into several components. There are considerations for employee interactions that are applicable to most situations. Then we guide you to consider the potential reasons for the gap between the intended outcome and what occurred. Then we offer suggestions for system redesign and considerations for interventions. We also offer suggestions of interventions that are not likely to be useful under certain circumstances. Errors are planned sequence of mental or physical activities that fails to achieve the desired outcome. One kind of error is an execution error, such as when I have the right plan to achieve my desired outcome, but I don't execute that plan as intended. Another kind of error is a planning error, such as when I have an inadequate plan to achieve my desired outcome. Violations are a deliberate departure from safe practices, but are intentional. This is what makes violations different from errors. Errors are always unintended. The negative consequences are unintended for both errors and violations. The decision tree on the front of the document is intended to be proudly displayed in locations where staff can be reminded that they will be treated fairly, and employees that do not intend to cause harm will be coached towards identifying appropriate interventions to prevent reoccurrence. The first question is, did the person know the correct action or procedure, how to perform it, or who was supposed to perform it? If the answer is no, you are guided towards the guidelines for managing planning errors to determine what was not known and develop an improvement strategy to address that issue. If the answer is yes, there is an additional question of, did the person perform the action or procedure as they intended to? Or if the action wasn't performed, was the omission intentional? If the answer is no, then you are guided towards the guidelines for managing execution errors to determine what might have prevented them from completing their task correctly or at all, and develop an improvement strategy to address that issue. And if the answer is yes, you are guided towards guidelines for managing violations to determine why the person intentionally departed from what was expected of them, and develop an improvement strategy to address that issue. On the following page, we discuss planning errors. We offer some considerations for employee interaction, potential reasons for the gap, and suggestions for system redesign and considerations for interventions. An example of a planning error could be a new CNA did not correctly position a resident in a chair, resulting in a stage 1 pressure sore. The outcome was unintended. The CNA was not trained on how to correctly use the positioning devices for this particular resident, and the care plan lacked necessary details. The intervention could be to review the systems for orientation of new staff, the training process for staff who have transferred to care for a new resident, and care planning documentation process to prevent a similar error in the future. Another example of a planning error could be only giving the flu vaccine to residents who do not presently have a cold. This may be done because the physician does not realize that new research shows that people can receive the vaccine even if they have a cold. So the plan to immunize those who don't have a cold will not achieve the desired outcome, which is to provide the flu vaccine to all those eligible in an effort to reduce the impact and complications of the flu among residents. Now, what if the plan is correct, but there is a failure in execution? An example of an execution error could be a medication aide giving a wrong medication to a resident when both roommates have the same first name. An intervention could be to put a system in place to ensure that roommates do not have the same first or last name to decrease the chance that an error could happen again. Another example is a resident not being toileted timely due to an interruption. A system could be put into place to minimize interruptions or share staff responsibilities. Now, everyone commits a violation at some point. Remember, violations are not the same as malpractice or negligence. Violations are intended deviations from safe practices, but negative consequences are not intended. Certain conditions are more likely to produce violations. In order to reduce the likelihood that the same violation will occur in the future, we need to understand the factors surrounding the act and not just blame the person, just like with errors. This is why we are still using a systems approach. We are looking at what we call the local workplace factors or the organizational structure, not just the individual. Here is a table that shows the increased likelihood that we will commit a violation. The strongest influence is the perception that we are not likely to get caught. Right below that is the inconvenience we experience by following the rules. Will it take more time, be a burden on someone else? If someone believes that they have the authority or status to violate the rules or procedures, then they are more likely to do so. Right below this condition is no disapproving authority figure is present. This means that we are all responsible for holding each other accountable. An example of a violation is a CNA occasionally completing a skin assessment documentation because of time pressures. There is a goal conflict between completing skin assessment documentation and completing other tasks. The CNA knew she was supposed to document, but makes a decision not to do it. An intervention could be to simplify the process for documenting or make it more convenient so that it takes less time to do the right thing. Another example would be a nurse requesting an order for an antibiotic for a suspected urinary tract infection without following the approved protocol. The nurse knows what the protocol is for diagnosing and treating urinary tract infections, but will believe there's a sufficient justification to disregard the recommendations and makes a conscious decision not to follow the protocol. There is the perception that the rule doesn't apply in this circumstance. Now that you understand how to use the decision tree and intervention tool, we suggest that each supervisor post the decision tree so staff can view it, and it will be a visual reminder that all staff will be treated fairly under a just culture. Each supervisor should have a copy of the intervention tool to reference when an opportunity arises. We suggest that you apply this tool to at least 2 coaching opportunities in the coming quarter. The Institute for Healthcare Improvement suggests that just culture decision trees or algorithms be reviewed at least twice a year with all supervisors. They suggest reviewing an example case together, either real or simulated. They also suggest that supervisors then review the case in their monthly meetings with frontline staff. In doing so, organizations can ensure that only one set of roles is used throughout the organization and that the roles are applied equally. Now pause the video and use the decision tree and selection planning tool to discuss some examples of planning errors, execution errors, and violations. Thank you for being dedicated to nurturing a just culture in your community.